Nancy Collins. I'm president of Greenbranch Publishing, and I'm publisher of the Journal of Medical Practice Management. Welcome today to soundpractice.net. This is another in our series of podcast interviews that we are doing with experts in medical practice management, and we are very pleased to interview today Judy Capko. The topic that we have for today's podcast is managing the appointment schedule, manage your day. And let me tell you a little bit about Judy Capko. Judy Capko of Capco and Morgan is the author of our best-selling book, Secrets of the Best Run Practices, now in its second edition. She is also the co-author of her new book, The Patient-Centered Payoff, Driving Practice Growth Through Image, Culture, and Patient Experience. Judy has specialized in medical practice operations and marketing, and hundreds of physicians and administrators have benefited from her advice and innovative, energetic approach to organizational management and strategic planning. Judy has gained national recognition in her field, working with both small and large practices, as well as major academic faculty practices from coast to coast. So Judy Capko, welcome to soundpractice.net.
Thank you, Nancy.
Judy, why is it that medical practices struggle so with managing the appointment schedule?
You know, Nancy, I think that's an excellent question. And honestly, I simply think it's that they look at the schedule as an on-demand system that reacts to patients' needs and getting them taken care of. They don't really even look at it in advance to see how they might organize it better or take a strategic look at it at all. In fact, they don't think about it because the next day it's going to look entirely different, because they do use it as an on-demand system. So whatever the patient needs, they kind of plug them in, and they don't really look at how they can be more organized, efficient, and more profitable if they manage the schedule better. See, in reality, it needs to be viewed as how do we accommodate patient demand against physician time requirements, because that's what it's all about. You need to make sure you can accommodate the patients without blowing the system apart and running, an hour late at the end of the day.
So how can the practice go about pinpointing the source of the unmanaged schedule? Because I think many of them know that they have a schedule problem, but how do they go about pinpointing the source of the problem?
Well, first they have to accept that it's a problem that can be fixed. They really think that the unmanageable schedule is something they have to live with. I mean, I've even had a physician say to me, what if we just put a sign up and tell the patients, be patient and wait, we're running behind? I go, no, you can't do that. That's not a solution. It's accepting that you failed at managing your schedule, and that's not okay. So really, the way they can do it is they need to understand the patterns that exist within their practice. And they don't realize that statistically there is an average there. If they take a look at a couple weeks of scheduling, they will see that there's an average number of patients that don't show up every day. There's an average number of patients that call and need to be scheduled in. And by understanding this, they can then prepare a schedule that addresses those anticipated demands and those anticipated lost patients, or eliminates those lost patients and better manages that for additional revenue as well, because each patient that's lost on the day is at least $150 when you look at the effort you put into it and the lost revenue. So the scheduling component of the practice system allows you to document patient arrival and rooming time. These practice management systems have become so sophisticated, you can run a report that will tell you when the patient arrived, if the patient didn't show, can tell you those kinds of things, so you can look at the flow within that day, but also to take a look at historically how many people are put into the system at the last minute and double booked and those types of things. So if you collect it on the front end of the practice, then you can back up several weeks, gather that old information, and do a real good job of trending and seeing where those gaps are. You can then build a reliable scheduling system that optimizes the physician's time and improves the profitability of the practice. See, if you can see just one more patient a day and remain on time and get out on time, think how much nicer it would be within the practice. Probably avoid some overtime, and easily generate at least $30,000 more in patient visits each year. That's a substantial gain. It really could pay for an additional employee.
Oh, and the patients would be so much happier.
Oh my goodness, yes. And you would be the chosen one. You'd be the practice that would be spoken about and talked about in the community. As they take care of you. You go in here, you're not going to have a problem. They'll see you when you need to be seen, and you'll be seen on time.
I think that goes far. I don't think practices can hide any longer from huge delays in the appointment schedule because of all the reviews that are online as well. That's many things that are mentioned.
That's such a good point, Nancy. And everyone has a busy life. It's not just the doctor's office that's busy. Patients are coming in they're working, and they schedule that sometimes on their lunch hour or in the morning. So, they tell the boss, I'll be in 15 minutes late, I have a doctor's appointment. That doesn't mean an hour late. They want to be seen. And some of them arrange their visits around their kids' school activities or when they're in school, and they just can't afford for you to be messing with their day.
But let's talk about when the patients are, what if the patients are part of the problem? They come late, they don't show up at all sometimes, or once they get into the exam room, they take a long time, abuse the physician's time. What do we do about the patients?
Oh, that's really good, because the coming in late and the don't showing up, I kind of put those into one category, and that category is they just don't value your schedule. And why don't they? Because you're not valuing it yourself. So they're looking and they say, when I walk in that room and I see standing room only in the reception room, I know I'm going to be waiting a long time. I won't even be missed if I don't show up next time. It's just, they won't miss me. In fact, they don't call me and ask me why I didn't show up. So, there's no real push for this. So, it's not a big deal if something comes up. And they kind of, the practice themselves set themselves up for that. So that's the first problem. And it's rather significant, really. If the patient doesn't feel they'll be missed, they don't feel terribly important. So that's one reality in itself. And then we have to shift this paradigm in managing the schedule and go do just that. You see, an important part of this, managing the schedule, is respecting the patient's time and educating patients that keeping their appointment is very important. And if you use the right tools and train the staff and actually, first of all, really make the commitment, you can make this happen. And you'd be amazed at how much better you can manage that system. Now, abusing the physician's time in the exam room is another story, and that's become a real problem, and physicians are really concerned about that because they're already struggling with the extra time needed for them to use the EMR system up on the front side. But in reality, abusing the time comes when we haven't clearly defined what the patient's coming in for. So if we know what the patient's coming in for and we're really clear at the scheduling juncture, then that will help. And then secondarily, if the patient starts talking about other things, you need to, the doctor needs to take control of that situation and, say, if you need additional things here, let's talk about it briefly, but let's schedule another appointment for you to come in and talk about that. Recently, Nancy, I was doing with my colleagues doing a assessment of a rather large primary care practice, and they had one physician in particular that just always ran behind, and it was really playing havoc with everybody in the practice. So they asked me if I would shadow this particular physician, and I did. And the first patient I went in with her had something in their purse. It was an elderly woman that was there for a pre-op visit. So they'd scheduled enough time for the visit. They went through all of this, and then just as she was wrapping up her visit, this elderly lady, I'll call her Mrs. Smith, asked the doctor if she would answer a couple questions for her, and she said, sure. And she sat down, and the gal pulled out of her purse, Mrs. Smith pulled out of her purse a blood survey that had been done on her son, and she wanted to know how this doctor saw this, because this was the recommendation of her son's doctor, and she wanted to know if she would agree with this. So she sat there, read the report, and went over it with the patient, gave free information, and took up a lot of time and got her further behind. So I could see how she just gets pulled into these things because she's so nice. And we need to help train our doctors on how to do that, and management needs to take the lead. It's not something you can dictate to a doctor. It's out of their realm of comfort. So develop some scripts that'll help them and do some role playing. And once they learn to do it, they'll find more comfort in it, and there's a way to appease the patient. You don't want to turn them off. You don't want to make them angry. But at the same time, you have to manage your day, and you can just say, I've allowed so much time. Maybe we can have a phone call after hours, or really, I just don't have time to do that today. Why don't you give that doctor a call? about your son and see if he can answer those questions for you. You know, there's ways to manage those things, and our doctors haven't been trained to do that very well. And you know, and I don't blame them for being struggling with this, because that's not what their skill set's all about. So,
Judy, can you give our listeners 3 tips to take control of their appointment schedule?
Yes, I can. First, establish realistic time frames for your visits, because you need to do it, again, based on time needed by physician, so you know how many patients your physician can really see in a day. And each physician is going to be a little different. So make sure you look at that and understand what they need for every type of patient. Now, when I say every type, I don't mean you have, 8 or 10 different scheduling types of slots, but maybe 4, like maybe 1 for your annual physical, maybe 1 for people that are seen periodically with chronic diseases, and then your annual exams, your what you see for an acute condition that just emerged, how much time do you need for these types of things, and then you should be able to simplify that down to about 5. And personally, I kind of like the 10 to 20-minute increments, because I see it when I do the time studies and practices that often they're almost all using the 15-minute increments. And when I time the doctor's time in the exam room, they're usually either taking 7 to 8 minutes, or they're taking 18 to 20 minutes. So imagine if you could define that on the schedule, that you could actually stay on time. So it really, the 10-minute increments allow you a lot of flexibility. And often they don't allow enough time for the new patients, so make sure you understand your new patient takes more time. And, of course, they should also come in a little early, because there's paperwork that's involved. But also they take more clinical time in the exam room as well. So you need to accommodate those things to take care of the schedule. And secondly, conduct a morning huddle with the team to look at the daily schedule and pinpoint. In fact, you might want to do it at the end of the day before, and pinpoint any possible glitches in the schedule that need to be resolved to make the day flow. For example, perhaps the patient's coming in after having ultrasound and you never got the report, so let's make sure that report's in file before the patient's seen. Those types of things, they really help. And then you can book beginning at one of the clinic session. By session, I mean either the morning session or the afternoon session, and then start to build your schedule rather than have appointments scattered all through the morning and then having holes in it. Start at one end of the morning and work your way to the other end. And the one time you might want to double book is the first one in the morning, because the doctor could be seeing one patient while the nurse is prepping the other patient, and it can work. So, but don't double book throughout the day. Plan your day appropriately and avoid this as much as possible. But the way not to leave blanks in your schedule is start at the beginning of a session or at the end of a session and work backwards, so that you, if you do have a blank, it's at the end of a session or the beginning of a session, and you can use that as work time.
And then let us talk about how the mismanaged schedule affects the practice finances. You touched on that earlier in the interview, but let's drill down a little bit about that.
Well, it can be huge, really. You're right, I already mentioned the financial gain of just one patient a day. But if you have a missed appointment rate of 15%, you get it down to a percentage that will likely add another $60,000 in revenue if you really reduce it substantially, because it's huge. It's not just the hole it leaves in the schedule and the unseen patient, but the patient's own health can be compromised, because they might have really needed to get in clinically, and now they haven't. And there's another element of the schedule that can really affect finances too, and it's not the mismanaged schedule, but it's the really thought-out schedule. One area we see as practice management consultants in our firm, Capco Morgan, we see a problem where the preventive care visits, and often in the gynecology practice, where the woman comes in annually for birth control pills and gets an examination every year, we see that they're very busy practice will postpone that annual visit 3-4 months out because they don't have it on the schedule. So the patient calls and says, I need my medications, and they go, I want to come in for my annual exam, and they go, well, Dr. Williams doesn't have an opening for 2 months. I'll book you out 2 months, but we'll go ahead and give you a refill on your medications to carry you over. Well, if that 12-month appointment becomes a 14-month appointment, at the end of the year, you've lost revenue. And every year that becomes a delay in revenue. That cycle gets delayed, that revenue loss continues on down the road. So it can become substantial. We've done some studies on that where there's hundreds of thousands of dollars that are lost in a practice because they don't see the annual patient, once a year. They see him every 18 months.
That's very interesting. Okay, good. Any other ideas related to the financials?
Well, I just really think that it's important for physicians to understand that an unmanaged schedule is a loss of revenue and it's a loss of productivity of your staff, and that's very, very costly. It's a silent problem, and it's a very essential problem to address because it does have an economic impact on the practice, and it also has a huge impact on patient satisfaction. An unmanaged schedule makes you look hurried. It means patients don't always get the attention they need or the service they need, and it means they have to wait to be seen in the office and sometimes have to wait to get in. And delayed care is always a problem you want to avoid. So it's pretty big. It's substantial. An unmanaged schedule does mean an unmanaged practice.
And it's very stressful for the staff members if the schedule is not clicking along smoothly. I'll share one experience I had recently where I was just in a practice, but I heard the very nice and efficient receptionist talking with another staff member in the practice, and they were actually pleased that there were 2 patients that morning who weren't showing up. Right, because it was going to give them a little bit more breathing room that morning. And I thought to myself, well, surely, I'm sure the physician would not want to think that this is a good thing. But that's what happens with an unmanaged schedule.
Oh, absolutely. And actually, at the end of the day, the physician doesn't say. I noticed we had a couple no-shows because they're also trying to get home to their family. It's really a very unusual situation, but it's so common in medical practice, and especially the busier they are, they think, well, we're busy enough. But, you're busy enough and being over-busy, it doesn't have to be that way. I mean, we can make that revenue work for us and get all those patients in and still get out on time if we really take a proactive approach to managing our schedule. That historical review will tell you the truth about your practice, and then you can prepare for it. Sometimes it will reveal that, heck, it's time for us to bring in a part-time mid-level provider, a nurse practitioner, or a PA to subsidize the patient care and make sure that we meet the demand of our patients. And guess what? Now we have even more revenue.
Right. So it really just needs to be treated like a project. It needs
Absolutely.
to be analyzed, and it can't be just a haphazard thing. It's a project, and you need to have the data.
That's right. You need to have the data, and then when you present that data and look for solutions, you've got to involve the entire team. My mantra, value the staff because they are what help you be a successful practice.
That's right. That's right. Absolutely. And with that, I would like to thank you, Judy Capko, for this terrific interview about the appointment schedule. Again, it's managing the appointment schedule. Manage your day. And this is Nancy Collins from Greenbranch Publishing and soundpractice.net. If you would like to hear more or get more information about Judy, please look at the website capco.com. You can also sign up for Judy Capko's blog there. And if you'd like to review the table of contents of any of Judy's books, visit Greenbranch Publishing. She's the author of Secrets of the Best Run Practices in the 2nd edition. The Patient-Centered Payoff, her newest book. And also I need to mention also the time management book that Judy did with us as well. So Take Back Time is also at the greenbranch.com site. So thank you very much, Judy Capko, for joining us today at soundpractice.net.
You're welcome.